artificial methods, oral contraceptive,
are known also as the pill OCs, BCs, BC tablets, or birth control pills. Advantages and disadvantages. They can lessen the pain of menstrual cramps, keep
It
acne
does not provide protection
under control, and
against sexually
protect
transmitted
against
infections,
certain
STIs,
cancers.
including HIV.
Side effects: breast tenderness, elevated blood pressure, headaches, nausea, bloating. Transdermal patch is a patch that
You may
attaches
experience
to
temporary side effects
your skin and
during the
contains
first few months.
medication. How it used: adhere to THD skin assay. Way to deliver drugs: they provide a specific, predetermined dose of medication that is absorbed through the skin and into the bloodstream. Advantages and disadvantages: offers several benefits over oral delivery, including smooth, continuous drug delivery, increased bioavailability, and reduced drug interactions.
It is a very effective method for preventing
Rash,
pregnancy as it blocks
redness,
the transport of gametes.
eye pain, redness,
This surgical
or
procedure
discomfort,
cannot be reversed.
blurred vision, sensing halos or colored images, agitation, vaginal ring, confusion, may ease premenstrual symptoms, and bleeding will probably be lighter and less painful. How it used: you squeeze the ring and insert it into your vagina like inserting a tampon. Advantages and disadvantages: it doesn't interrupt sex. It's easy to put in and take out. You don't have to think about it every day or each time you have sex. The ring isn't affected if you're sick, vomit, or have diarrhea. It may help with premenstrual symptoms. Side effects: you may not feel comfortable inserting or removing it from your vagina. You can have spotting and bleeding in the first few months. Subdermal implants involve the delivery of a steroid, progestin from polymer capsules, or rods placed under the skin. Advantages and disadvantages include long-term contraceptive action without requiring the user's or provider's attention, low dose of highly effective contraception without the use of estrogen, and fertility is readily reversible after the removal of implants. Hormonal injections prevents pregnancy by injecting a synthetic version of the hormone progestogen called dipomedrixcipro, gestaroline acetate, DMPA. Advantages and disadvantages: it can be useful for women who cannot use contraception that contains estrogen. It's not affected by other medicines. Side effects include weight gain, headaches, mood swings, breast tenderness, and irregular bleeding. Intrauterine device, also known as intrauterine contraceptive device or coil, is a small, often T-shaped birth control device that is inserted into the uterus to prevent pregnancy. Advantages and disadvantages: it protects against pregnancy for 5 or 10 years, depending on the type. Once ENID is fitted, it works straight away. Chemical barriers against infection include enzymes in tears, saliva, and mucus that break down the surface of bacteria. Advantages and disadvantages. Protects against pregnancy. Diaphragm. Located below the lungs, is the major muscle of respiration. Advantages and disadvantages. You only need to use diaphragm or cap when you want to have sex. Side effects. Strong odors or vaginal discharge if the diaphragm is left in too long. An allergic reaction to the material in the diaphragm. This is rare. Is a little cup made from soft silicone. Advantages and shaped like disadvantages. Can be used as a barrier method of contraception, but should always be used with spermicide. Does not protect against STIs. Male condom is worn on the penis. It is usually made of latex, a type of rubber. Advantages. They are the most effective protection available against STIs. They do not affect future fertility for either a man or woman. Female condoms are made from soft, thin synthetic latex or latex. Advantages and disadvantages. Help to protect both partners from STIs, including HIV. They're not as widely available as male condoms and could be more expensive. Surgical method. Prevents pregnancy by not giving the opportunity for semen to enter the vagina. Advantages and disadvantages. Avoid the risks that come with sex, like pregnancy and STDs, until you're ready to prevent and or handle them. People committed to abstinence may unexpectedly have sex and may not be prepared to protect themselves from pregnancy and STIs. Natural methods. Abstinence. It means you've decided not to have sex. It includes vaginal, oral, and anal sex. Advantages and disadvantages. Avoid the risks that come with sex, pregnancy, and STDs until you're ready to prevent and or handle them. Calendar method. Advantages and disadvantages. They do not cost money. They do not cause side effects like the hormonal methods of contraception. It's not as effective in preventing pregnancy as other birth control methods. Basal body temperature. To use the basal body temperature method, take your basal body temperature every morning before getting out of bed. How it use. Record your cervical secretions for several cycles. Advantages and disadvantages. May not accurately predict ovulation in all women, including those with irregular menstrual cycles. Can be used as a way to predict fertility or as a part of a method of contraception by helping you gauge the best days to have or avoid unprotected sex. Cervical mucus method is a way to identify fertile times to help you gauge the best days to have or avoid unprotected sex. Advantages and disadvantages. Is good for determining when you're fertile by using your vaginal discharge as a way to determine when you are in your cycle. This method is not always easy to learn without the guidance of your OB/GYN or doctor. Symptothermal method. when you use more than one. Fertility awareness method. FAM together, it's called the symptothermal method of birth control. Advantages and disadvantages. The symptothermal method has a significant advantage in effectiveness because it combines the calendar, cervical mucus, and temperature methods. However, this technique shares ovulation detection disadvantage that each of these techniques has individually. All you have to do is pee on a stick or strip or pee in a cup and dip the stick or strip into. Advantages and disadvantages may be beneficial if you have slightly irregular periods or find other methods of tracking your fertility difficult or unreliable. Can be expensive and there are no guarantees. Advantages and disadvantages. If used correctly, does not affect breastfeeding and is always available for primary use or use as a backup method. It doesn't offer protection from sexually transmitted. Thank you for watching.